Today we're in conversation with a really remarkable woman. Dr. Shahina Qayuum is one of the best pulmonologists in Pakistan. She's traveled extensively for her work to spread her expertise and share awareness about a lot of pulmonary diseases like tuberculosis and AIDS and such. Today she's in conversation with me, and we're going to ask her a few questions about her journey and how she went from clinical work to working in public health. Could you tell us how your journey in medical started?
Well, I wanted to become a doctor, and so I joined this profession, and somehow or another I turned out to be a pulmonologist. So it is a journey which is by fate.
Was it always medical, or was there ever a point where you thought you wanted to quit and start on a different path and start a different career in some other subject?
Well, I was good at physics and maths. So I wanted to pursue my career in maths and physics. Somehow or another I loved it. But then, like, my parents wanted me to become a doctor, so I joined this field. But then this physics and maths has always helped me in my research and my work, so I never regretted it.
Do you think the reality of this field is in contradiction with Pakistan and like how people perceive the field in Pakistan? Because medical is very glamorized. So like, how is the reality of this field different to how people assume it's going to be?
Well, there is no glamour in medical field. We see lot of death, lot of suffering, and when there is death and suffering around you, there is no glamour. People think that we are making lot of money, but believe me, the amount of time we spend in this field and the amount of work we have to do is far, far less than what we are earning. So there is no glamour attached to it. It is a misconception. There are other fields which make you more glamorous in very early, but this field is not glamorous. It is a very tough field.
There is a general distrust of doctors that exists in Pakistan. Like, a lot of people don't trust their healthcare advisors. People think, we need to get a second, third, fourth opinion because galat diagnosis hai or whatever. So why do you think is that a founded fear that we have as a nation, or do you think that that's a complete misconception?
This is something in our culture. We trust a person who is coming to open a drain, and we never question him how he's doing it. But if you ask a question about health, everybody is having a solution. If you are in a company of 10 persons, 10 persons will be having their own experiences and their own perception to share. So if you discuss a disease, beside any doctor, everybody is going to give you an advice. So people are confused, and therefore they go from one doctor to another to find the solution, which should not be the case. The primary healthcare person should be responsible for referring the person to the senior persons. But in our case, it is not the case. We are shopping for doctors. We are shopping for the healthcare. It is a reality. It is a reality. Initially, it used to make me feel bad, but then I have realized that it is a reality of our society. You cannot change your society, so you have to change yourself, and you have to adopt your work according to the norms of the society. So that is what we have done.
So for your career, you've traveled a lot. You've traveled abroad, and you've done a lot of conferences and such. Was there ever a time that you thought, as well-read and as experienced as you are, that you could just quit in Pakistan and go travel and start a career somewhere else abroad, which is generally the dream of a lot of people? Did you think that you could just leave Pakistan or not?
I had opportunities, and in my career, to leave Pakistan and work in other countries, but I never wanted to do so. I'm a family person. I wanted to live by my family, and moreover, I wanted to serve Pakistan. It is not a sentence or in words. I have really wanted to serve my people and my Pakistan, and I wanted to work here. So I have always of the opinion that if you are outside, you are always on work, and you are not getting paid enough. So if you are getting a lesser pay in Pakistan and you are serving your own public, it was a better option for me, and I have never regretted it. I have left the opportunities that have come in my way, but I have never regretted it.
So the NGO that you work for, Bridge Consultants Foundation, what about it appealed to you that you thought that you want to get into not only public health, but you have to work with this specific NGO?
Well, initially I started my career as a pulmonologist, and then I was focused on tuberculosis. This organization that I am working with is working for tuberculosis and HIV basically. And so when we are running projects in different part of the country, especially in the rural areas, so it appealed me. So I joined this organization to serve basically the persons suffering from tuberculosis, and that is what I love most. And I working for tuberculosis patients. So I joined this organization because the kind of work they are doing is according to what I wanted to do. So we are good. We have got good relations, working relations.
So again, Bridge Consultants Foundation, it works with a lot of marginalized groups, which we can also say that these are the ignored groups. They're ignored by the government, they're ignored by the state, and mostly the people as well. Can you talk about the role of the government in the NGO and like in healthcare generally? Like, do you think that they are completely removed? Do you think that they help? Are they a hindrance, or are they actually doing something? So like, why are they so removed from helping the marginalized people?
We are mostly working with the marginalized population and the poor population. The marginalized group we are working with are the transgenders, the sex workers, male and female both, and the injectable drug users. Now these are the population which are looked down upon in our country. They are just they have got the stigma and discrimination attached to them, and most of the organization and most of the healthcare provider even, they are not giving them proper care. So working with them is sort of a service, and we have penetrated these organizations. We have got good relation with the leaders of these organizations, these persons, and we are working to look for the health-seeking behavior, to improve the health-seeking behavior of these persons. We are working for the screening of different diseases like HIV and tuberculosis in these populations, and we are helping them to seek a health coverage, the treatment and the diagnostic facilities. So we are working this way, and it is very, very, very satisfying. When you are working with such population, it is really satisfying. Well, we are working with these population through the international aid. We are getting aids from Global Fund for working with these population. But having said that, we are having a partnership with government. We are basically working as a public-private partnership. So we are helping government to reach these population, and we are helping this population to reach the health services. And also we are involving the private healthcare providers to reach the government facilities, and we are trying to, our name is Bridge, so we're trying to bridge the gap between between the public sector and the private sector and different type of populations. So we are removing the misconceptions between the two, and we are getting the drugs and the diagnostic facilities to the doorsteps of these population. So that is how we are helping it.
So between right now you're a trainer as well as a clinician. So do you ever think that you want to quit the one? Do you prefer one over the other? That you think that I might quit one and pursue the other field 100%, and or do you enjoy balancing both things in your career?
No, I love both. I love both. I love being a clinician. This has helped me to understand the individual problem. If a person is having tuberculosis, I can feel the misery he or she is undergoing. If a person is having HIV or AIDS, I can connect with this person. And in the public health, you plan, you design programs, you work for control, and you work for cure. So I am at a place where I can understand both, and I can work for both, and that is what I have been doing. I love being a clinician, treating an individual, and simultaneously I love being a public health person, being a trainer, giving my knowledge to what I have learned throughout my life to the others, and bridging the gap between the two, because the public health is for the society and the clinician is for the individual. You have to balance the both. So that is what I have been doing, and I love both. I don't want to leave either. I want to help the individual, and simultaneously I want to design the programs and projects for the society to on the larger scale. So that is what I have been doing.
Okay, thank you so much for your time. Thank you for doing this interview with me. It was a great experience to hear about the Bridge Consultants Foundation and your work and your experience. Glad that you could join me here.
My advice to the persons listening or the younger ones is that you should enjoy what you are doing. Once you enjoy your work, then you give your maximum to, and it becomes your passion, and then you excel. So you should enjoy what you are doing, and whatever the work you are, whether you are a doctor, whether you are a clinician, whether you are a public health person, whether you are even a player, you should enjoy. Your work should not be without enjoyment. You should always enjoy working, and that should become your passion, and then only you can become a very successful person wherever you are.